Welcome to our City Lab presentation on Housing First as a solution to drug paraphernalia on HSR properties.
My name is Nelda Cherrier.
I'm Stephanie Hopkins.
I'm Joanne Kearon.
And I'm Robin Tetreault.
We wanted to start the presentation with a quote by Enrique Penaloza. An advanced city is not one where even the poor have cars, but rather one where even the rich use public transportation. This quote resonates as it speaks to how we view public transportation as a public good and how we see HSR as an integral part of Hamilton as a sustainable city. The challenge posed to us by Ali at HSR was one dealing with drug behavior, including substance use and drug paraphernalia in HSR buses, terminals, shelters, and bathrooms, which has been identified as a public safety concern. Our starting point was to understand why people use drugs in public spaces. A recent study in London, Ontario indicates that people use drugs in public spaces because they are homeless and they do not have a safe place to inject. This led us to hypothesize housing first as a solution, which shaped our hypothesis. Among people who use drugs, is a housing first approach more effective at decreasing drug use in public spaces compared to treatment as usual approach?
We performed a search of 4 databases total: Medline, Embase, Health Evidence, and Tetreault, as well as a search of gray literature on Open Gray. We focused on search terms covering housing first or comparable program providing non-abstinence-based permanent housing, the population of homeless individuals and the phenomena of substance abuse and drug paraphernalia, and lastly, the setting of public spaces. Snowball sampling was conducted on systematic reviews generated through this search, while the systematic reviews themselves were excluded from this rapid review. All studies published after 1990 offering housing first as an intervention compared to treatment as usual, with a measure of both substance use and housing stability outcomes were included. Studies were excluded based on a focus on safe injection sites or homeless shelters as the intervention, substance use focused strictly on alcohol use or rates of bloodborne viruses as the outcome, and/or studies attributing homelessness to substance use, being the opposite of our research question.
This rapid review included a total of 14 studies, where Housing First consistently improved housing stability among people who struggle with chronic homelessness and use substances. However, there were mixed findings on the impact of Housing First on substance use. 4 studies found that those in the Housing First group decreased substance use, while 1 study found that those in the treatment as usual group decreased substance use, and the remaining found no significant difference between both groups. Nevertheless, since homelessness is one of the primary factors in substance use in public spaces, by improving housing stability and potentially reducing substance use, Housing First can reduce the use of substances in public spaces and in turn decrease the amount of drug litter found in public spaces as well.
Therefore, we have the following recommendations. First of all, Housing First as a harm reduction strategy is effective at reducing the harms from substance use and may contribute to reducing substance use itself. We therefore recommend HSR adopt and maintain harm reduction principles in all of their policies and procedures. Secondly, Housing First improves housing stability amongst people who use substances and struggle with chronic homelessness. We therefore recommend HSR, in as much as it is within their ability, support the implementation of Housing First by the City of Hamilton. Lastly, Housing First has the potential to reduce substance use. We therefore recommend HSR advertise available housing programs in high drug litter areas within HSR. Thank you very much for listening. And if you have any other questions, please feel free to reach out to us.